Welcome to Native Bidaské, Native News Online's weekly spotlight on the people making news and leading change in Indian country. Thank you to our platinum sponsor, the American Dental Association, for making this live stream possible.
Welcome to another episode of Native Bidaské. Part of our continued coverage of health issues in Indian country, we have a very special guest with us today, and it's Dr. Meghan O'Connell, who is a Cherokee citizen, and she is the Chief Public Health Officer for the Great Plains Tribal Leaders Health Board. Welcome, Dr. O'Connell. How are you?
Good. Thank you so much for having me.
Hey, you are. It's our pleasure, and we have a very serious subject matter to talk about today, and it's something that I think because of the stigma associated, it's something people really don't want to talk about. And it's actually, it deals with a report, a vital signs report that was issued back in November, on November 7th by the Centers for Disease Control and Prevention, the CDC. And it really had some staggering numbers in there that during the last decade, the cases of syphilis among newborns was like up 755%. And Dr. Meghan, can you tell us what you know about this report?
Sure. So I think you're right that unfortunately people don't really want to talk about syphilis because there might be some stigma associated with that. But there really shouldn't be. You know, syphilis is an infection like any others. It's an illness. And it's really important to talk about it so that people can get tested and treated. So I really appreciate you bringing this topic up.
But yes, some of the conversations we've had with people from the National Indian Health Board suggest that in the Great Plains area, and so I'm glad you're with us today, there's really been a problem among Native people. And the report said among African Americans, Hispanic, and Native Americans, there are 8 times more likely to have babies being born with syphilis, 8 times more than that of a non-native white woman. And so those are pretty staggering figures as well.
Yeah, unfortunately, the statistics are pretty grim. Syphilis has been increasing in the United States, as you noted, for some time among all races. But around the pandemic, around 2020, 2021, we saw a really sharp uptick in the number of syphilis cases around the country, but in particular among Native people, which includes Native babies.
Well, that is really tragic. And tell us some of the implications, or why is it so important that we try to prevent this? I mean, what goes on when a baby's born with syphilis? I mean, it can result in death, correct?
Correct. The CDC says that up to 40% of babies who are exposed to syphilis and don't get treated can die from the disease. So, you know, some diseases, when the mom gets them during pregnancy, may not impact the baby very much. But unfortunately, syphilis is one of those that can have lifelong impacts on the baby. It can cause stillbirth, it can cause death shortly after birth, and it can cause lifelong problems. Fortunately, the good news is that syphilis is actually entirely treatable and curable most of the time with a single shot of penicillin. So if moms are diagnosed with syphilis early enough in their pregnancy and are able to get treated before delivery, the babies will most likely be absolutely fine. So there is a silver lining in terms of treatment being available.
What are some of the symptoms that maybe a woman did not realize she was infected with syphilis? What were some of the symptoms that would maybe come to the forefront that maybe she would want to go see her gynecologist or her medical doctor and say, hey, I have a problem? Whoa.
Yeah, unfortunately, syphilis among doctors is known as the great pretender because almost anything can be attributed to syphilis. Some of the more common things you might see, though, are a sore in your genital area or mouth. It's called a chancre. It doesn't hurt, though. So if it's not visible, you might not even notice it's there because it doesn't cause any pain. You can also get a rash. often on your palms of your hands and the soles of your feet, which is kind of an odd place to get a rash. Or you can have kind of other vague symptoms like just not feeling well, or having swollen lymph nodes, that kind of thing. But the sores, the chancres, and the rash are pretty dead giveaways that it might be syphilis. But again, those can be missed because if you do nothing, they'll go away. So even if you don't get tested or treated, they will go away on their own. So you might think you're fine, but you still can have syphilis if that's what's causing those symptoms.
And the syphilis remains in the bloodstream, even though some of those sores may have gone away. Is that what you're saying?
Yeah. So you might, when you first get it, for example, you might have a sore that maybe you notice it doesn't hurt, but then it goes away after not very long, and you think, well, that was kind of strange. I don't know what that was, and thinking that you're fine, but you're not. If it is syphilis, you still need to get treated because you still have syphilis, even though the symptoms go away. And syphilis can even cause an infection for years and years and years and not cause any problems for decades, and then years later start to cause issues in someone. So that's why it's really important to get screened, even if you think you didn't have any symptoms or you don't remember or you're not sure you've been exposed.
Well, tell us the realities of if somebody on the Great Plains who's Native American finds out she's pregnant and goes in to the doctor. Tell us, is it common practice for like an IHS facility, clinic, or a hospital to test for syphilis?
Yeah, that's a great question. Before this current outbreak, it was pretty standard that everybody got tested at their first prenatal visit. So whenever you first show up, you get a whole bunch of labs, and syphilis was included in that. Now, because of the increased rates, it's recommended that people get tested 3 times. So that first visit, again, at the start of the 3rd trimester, around 28 weeks, and then again at delivery. Now, unfortunately, the test at delivery is important because we want to make sure that the mom wasn't infected when she delivered the baby. But at that point, it's too late to prevent a case of congenital syphilis. Those previous 2 times, at the first prenatal visit and at the start of the 3rd trimester, are really important because that's when you can treat the mom and prevent the baby from getting congenital syphilis.
And tell me this, and we're talking the realities, and this is not necessarily an easy subject to talk about, but the partner, okay, that may have given the mom syphilis, are they automatically, once it's discovered that a woman has syphilis and she's treated, which is great, is she then required or asked to talk about who her partner is, or maybe could be multiple partners? So tell us about that part. As I said, it's not easy to talk about.
Yeah. And again, as a physician, I talk about this stuff a lot
Sure.
in forums like this and with individuals. So I know that a lot of people can feel uncomfortable, but I really just want to encourage people, don't feel ashamed, don't feel uncomfortable. Us as healthcare providers, we talk about it with people all the time. We don't have any judgment about that. We're just here to help you and make sure you get better. And I would say the same for our public health colleagues that may be looking into the cases to try to help you get you treated. So as you mentioned, if you're diagnosed with syphilis, hopefully whoever diagnosed you will ask about your partners getting treated as well. Ask if you want to contact them, help them arrange appointments, that kind of thing. And the health department will often also reach out and ask you who your partners were so that they can reach out and help those people get treated. And it's really important to make sure that your partners get treated for a number of reasons. First of all, it helps stop the outbreak, right? The more people that get treated, the less syphilis there is, the better we're doing. But also any partners that you still have contact with, if you're treated and they are not, they can give you syphilis again. So unfortunately, once you've had syphilis, you can get it again once you're treated. So if you don't treat all of your sexual partners, then they can give it back to you and you can just get infected again and have to be treated again.
Now, a quick word from our sponsor. November is Native American Heritage Month. Our people have thousands of years of history on this land, but we also play a vital role in contemporary society. We are astronauts, physicians, and attorneys. We are journalists, entrepreneurs, and fashion icons. We serve our country. At Native News Online, we celebrate Native American heritage every day of the year with stories about our relatives who are making news and leading change. We are free and independent Indigenous-led media. We are trusted in Indian country. Our role goes beyond reporting the news. We make an impact by informing and uplifting our people. Our mission is to make sure Native people are seen, heard, understood, and valued. That's why we've written hundreds of stories about Indian boarding schools, the repatriation of our ancestors, missing and murdered Indigenous people, and the overdose epidemic in Indian country. Because we know when tribal communities come together and stand united, there can be healing for our elders and for generations to come. Native American Heritage Month is a great time to show your support for Native news. Please give from your heart so we can celebrate Native voices year-round.
So during the course of 9 months, and the woman typically doesn't find out she's pregnant right at the first
Right.
month, but there really is of importance that the woman is treated or tested, I should say, during that pregnancy multiple times. Or you said up to 3 times?
Yes, right now the recommendation is really 3 times for these areas that have really high rates of syphilis, because you want to be sure you catch everybody. But of course, if you're pregnant and you've already been tested, but then you were exposed again, say you found out one of your partners had syphilis, or maybe you had one of the symptoms, like a chancre, it's worth going back in and asking again about being tested, right? So if you have some concerns, you can always be tested again to make sure that you, say, weren't re-exposed or reinfected, or infected for the first time.
Yes, and actually, for the well-being of that child too, the unborn child, and as it's born, the safeguarding of that is just so critical as far as I'm concerned. And so, this is a tough conversation, but I'm glad we're having it because it sounds like there's a big problem. How big a problem is it on the Great Plains?
Well, the Great Plains, like a lot of the country, have seen huge increases in syphilis. Unfortunately, in the Great Plains, we're seeing some of the higher rates. For example, in 2021, which is the latest, most recent national data we have from the CDC, the state of South Dakota had the highest rates of syphilis in the country, which again is one of the states that we serve with the Great Plains Tribal Leaders Health Board.
And once again, I think I heard you say a single shot of penicillin will help cure this, or will cure it. Is it one shot?
One shot. It's a little bit, of course, syphilis can't be easy, so it's a little bit more complicated than that. But for the most part, any new case of syphilis will be treated with a single shot of penicillin. And that's it. It has a very high cure rate. It works really well. And all you need is one shot.
Yeah, and when I read through the report, one of the things that I took away, one of my biggest takeaways was so often this could have been prevented, and that's it's about. I think as a doctor, physician, you talk about prevention all the time, I'm sure.
Yeah, what's frustrating or sad about this current outbreak is not only that syphilis, we know how to test for it, that we can prevent congenital syphilis cases. It's that it's, like you mentioned, relatively easy. It's just one shot of penicillin. I think, unfortunately, there are a number of factors that came together to make those things much harder, especially in Indian country. So, for example, the pandemic occurred, which made it harder for people to access care, right? Because our hospital systems around the country were overwhelmed, or people might not feel comfortable going in for screenings, that kind of thing, because of COVID. There's a lot of areas that have a shortage of prenatal care, so that can make it harder as well to get screened. And of course, there's a national shortage of penicillin right now that can make it harder to even access the medicine that is curative of syphilis.
Why is there a shortage of penicillin?
So penicillin is the type of penicillin that's used for syphilis, has been on shortage since the summer. June, July, I believe, was when the announcement was made. It's distributed by Pfizer. And again, there are a number of reasons why there's a national penicillin shortage, partly to do with the increase in syphilis cases and the amount of penicillin that's been used to try to address that is kind of more than was expected, along with some other drug shortages that impacted the penicillin usage. But ultimately, it means that there's less penicillin right now than we need to treat everyone for syphilis.
But yeah, and if somebody gets that word from their the medical facility, clinic, or wherever, that they still need to be persistent and find out when they're going to get the new batch in, right? So that just don't go away, because it has to be dealt with. I know, like when I go to the doctor or the clinic, and I actually go to an IHS clinic here on Potawatomi, in my hometown. I'm asked, am I allergic to penicillin? Are alternative drugs out there? Somebody is maybe allergic to penicillin?
So yes and no. For non-pregnant patients, there is an alternative. Those people are recommended to get doxycycline, and that actually is the current CDC recommendation for everyone except pregnant patients because of the penicillin shortage. Doxycycline is not as easy as penicillin. It's not just one shot. It's 2 pills a day for a couple of weeks at least.
Okay.
So that can be harder for people to take, just because pretty much nobody, including myself, takes pills 100% of the time. And so that can make it a little harder. But if you're pregnant, the only medicine you can get actually is penicillin. So even if you're allergic to penicillin, you will have to go through what's called desensitization, so that you can receive the penicillin, because there's no other medicine you can have during pregnancy, because the doxycycline can be harmful to the baby. So if you're pregnant, it really is the only medicine out there for the treatment of syphilis.
Thank you to our platinum sponsor, the American Dental Association.
So I really appreciate how thorough you are being on this, Dr. O'Connell. This is great. Tell us this: what are some of the side effects if somebody is allergic to penicillin? Is it like rashes, headaches, or what are the?
Yeah, so if you go through people's charts, I'm sure a lot of you out there have somewhere in your chart a history of penicillin allergy. It's fairly common for people to report that, often from childhood. You know, I got a penicillin shot and then I got a rash and my doctor said I shouldn't have that anymore. But if you're looking, say you're pregnant and you need a penicillin shot, your healthcare provider should ask you lots of questions to try to figure that out and can actually do tests. What we're really worried about are people who are severely allergic to penicillin. So you've had a penicillin shot before or taken penicillin, and it actually caused an anaphylactic reaction where you couldn't breathe, or had trouble breathing, that kind of thing. Most people who have a history of a penicillin allergy haven't had that type of reaction, or may not have a penicillin allergy at all. So that's why they'll try to go through your history really carefully to figure that out, and then do the desensitization process if needed.
Mm-hmm. And especially those who just get mild rashes or whatever, the results of a healthy child is far outweigh the.
Yeah, it can be. I can imagine it'd be really scary if you're allergic to penicillin, or you've always been told you are, and somebody's going, well, no, you really need to take this medicine. It's one of the very few instances in medicine where the risks of not taking the medicine outweigh the risks of taking it, even if you're allergic. So of course it should be given by somebody that knows what they're doing, and all the right safety guards are in place. But because untreated syphilis can cause the death of an infant, that's why it's important to take a penicillin shot again with all the right safeguards in place, even if you're allergic and you're pregnant.
Yes, and we do want healthy babies. Tell me this: if a child is born with syphilis and survives, and that is the risks are really great. I mean, I was like 6% are stillborn if the mother has syphilis, and this is from the report. And there have been 51 deaths. I guess my question is, if a child survives, what are some of the long-term negative impacts on that child? Is it like learning disabilities, or what have you found to be true?
Yeah, it can be a wide range of issues. Some babies are born with syphilis. They may not have any symptoms, but say their test is positive and their mom's test was positive, and then they get treated in the NICU usually for a week and a half or a couple of weeks. So all of these infants will need a fairly long stay in the NICU for treatment with penicillin. And some of them do fine and they don't have any long-term effects. Some do have other issues, like you're saying, that may have problems with their bones and their hearing and other things like that. I will say, not that long ago, there were not very many syphilis cases in the US and particularly not very many congenital syphilis cases, I should say. So I think we're going to see, unfortunately now with all these congenital syphilis cases, what kind of problems they will have in the long run, right? Because there's a lot more babies being born with congenital syphilis, and they'll have to be monitored and make sure that they receive the care they need over the course of their lifetime, not just at delivery.
Wow. Dr. O'Connell, you have been very thorough, and I really appreciate this. And we hope to have you back on Native Bidaské anytime you have if there's concern you have that you don't see that the mainstream media is not covering, particularly as it relates to Native Americans. We really invite you back anytime you want. Any last words you want to say on this subject?
I would just encourage everyone to go get tested for syphilis. It is the Indian Health Service recommendation that everybody be tested yearly. All Native people be tested yearly. So if you haven't had your test yet, go get tested. Make sure that you don't have syphilis. It's easy to miss. You may not feel sick, but all of us need to be tested. And if we have the disease, be treated to decrease the rates of syphilis and make sure there are no more Native babies born with congenital syphilis. We all have to work on this together to get the rates down to protect the Native infants.
And thank you, Dr. O'Connell. You have been spectacular, and I really like how thorough you are. So, good wish to you, and you have a safe holiday season.
Thank you. You too.
And to our viewers, Miigwech for tuning in to another episode of Native Bidaské. We dealt with a very difficult subject matter, but we'll be back next week with another episode of Native Bidaské. In the meantime, during the holiday season, go visit your grandparents, take care of them, love them, give them hugs. They're precious. Miigwech. Everyone have a great week.
Thank you to our platinum sponsor, the American Dental Association, for making this live stream possible. If you appreciate what we do here at Native News Online, we invite you to donate to support our continued work covering Indian country. You can scan this code with your smartphone or go to the link located below this video to donate today. We greatly appreciate your support. Please be sure to subscribe to our YouTube channel and follow us on Twitter, Facebook, and Instagram. And be sure to scan this code or go to the link below to subscribe to our newsletter. Thank you for joining us today, and please be sure to join us again next week for another episode of Native Bidaské. Miigwech.